For the NHS, data should be the foundation on how best to use our resources, future plan and deliver services for the population and the economy. But when it comes to our most important senses, sight and hearing, there's been no national study carried out and therefore no national data. Instead, we have a patchwork of figures from different groups and charities, making it impossible to know what's needed and where. Now we have the results from a regional pilot by the UK National Eye Health and Hearing Study, which provides evidence of the need for a nationwide programme to understand the bigger picture when it comes to sight and hearing health.
There's a considerable economic cost for vision and hearing impairment in the UK. It's estimated around £60 billion per year. If we are able to institute a study, a nationally representative study, which gives us the evidence base for screening programs and trying to detect vision and hearing impairment at earlier stages before it becomes advanced, there is very considerable benefit to the individuals who will be saved from losing vision or hearing, but also to society as a whole.
The regional pilot took place in Cambridgeshire and Peterborough, across a mix of rural and urban communities. More than 500 people participated after being randomly selected to be invited. The results showed 1 in 4 people have sight impairment in at least one eye. Imaging of the interior of the eye highlighted preventable eye disease, which was unknown to many patients. For example, 1/3 of people with suspected glaucoma were unaware they had any evidence of this. And 1 in 10 people had a sight-threatening disease, which required referral to an eye care specialist. 7 out of 10 people had some hearing loss in one or both ears. 2 in 5 people had impacted earwax affecting their hearing, which we removed, a service unequally delivered across the NHS. Only 1/3 of people who had hearing impairment were wearing a hearing aid, and 3/4 of them had never had a hearing test. The results come as no surprise to clinicians.
As we know from the study, that lots of patients have problems with their hearing that they're just not aware of. We know that untreated hearing loss, particularly in midlife, is the biggest modifiable risk factor for dementia. Loss of hearing separates people from people. It leads to social withdrawal, isolation, depression. In the working age population, it increases your chances of being unemployed or underemployed. Those are all significant issues for people beyond the quality of life impact of being able to appreciate music and the social interactions that depend on hearing.
For hearing, the data currently in use is more than 50 years old. There is no national screening programme for hearing. Although sight tests for the over 60s are free on the NHS, we have no reliable data on why people do or don't use the service. The College of Optometrists says the profession desperately needs better data to enable their members to adjust this free service to meet the needs of the population.
We've got a gap in the data in that we don't know anything about the people who aren't coming to see their optometrist or are only coming to see their optometrist sporadically, and who may be then showing up in secondary care with quite late stage disease, which is obviously too late, and they may be able to receive some treatment, but they won't have received that earliest treatment, which is really going to help them maintain their vision for as long as possible. Without this good quality population level data for the UK, we're continuing to try and solve the problems that we see in eye health provision with a blindfold on.
UK NEHS says a national study into vision and hearing would also support the government's 10-year health plan, which includes tackling health inequalities, with a much-needed focus on prevention and service evaluation.
At the moment, we don't know how many underserved communities have an unmet need, but we do know that certain groups of people have a much higher risk of blindness, and this is likely to be caused by different eye diseases for the different groups of people. So for example, my research has shown that people from South Asian and Black communities have a much higher risk of one eye disease, which is diabetic retinopathy. And this is quite different from another group, for example, older people who are likely to suffer from another eye disease, which is age-related macular degeneration. So the profile of unmet need is going to be different in different groups.
UK NEHS says a lack of national data means the UK lags behind other countries when it comes to vision and hearing.
I remain persistently embarrassed about the fact that the UK has no population-based data, while other countries around the world, and particularly some countries in the lower middle income country grouping, actually have much better nationally representative data than we have. And so we really do need to improve things in the UK.
Researchers say a national study will benefit the population, the NHS and public health in multiple ways.
The other really important aspect of this study is that for the first time we have data of vision, hearing and quality of life, and also other metrics. And we know that reduced vision and hearing are really significant risk factors for cognitive decline. So identifying this unmet need and addressing unknown reduced vision and hearing losses will go towards reducing the risk of early dementia, and really also the risk of falls.
Without a national study, researchers say nothing will change.
Sadly, if we continue to have an ad hoc situation where we don't really understand how much of an unmet need we have in the population, we will be unable to plan services effectively going into the future. We simply have no understanding of the need. We can't forecast what we will need in the future, and it's a situation we can't be allowed to continue.
The UK NEHS has been developed with close collaboration of the majority of eye and hearing charities. All of our generous funders across the sector believe the data collected by our pilot demonstrates the need for a national study and the importance of planning the next steps to prevent hearing and sight loss.